Good morning again, everybody. So we have dads on our minds this week with Father's Day approaching, and just men in general, really, because it's Men's Health Week. Dr. Mark Buchanan is a primary care internist at UConn, joining me in studio this morning. Doctor, good morning to you, and thanks for coming in.
Thank you.
So we're thinking about guys this week. We want to go through some of the top health threats that men are facing and how to avoid them. First of all, I was, you hear that men die earlier than women, but when you hear it this way, that 14 out of the 15 of the top causes of death, men lead women in, boy, it sort of hits you right in the face.
It does. It's a somewhat dangerous thing to be a man, but we make the best of it.
So we want to make it better for you guys. First of all, what are the things that men are really dealing with here? There are three biggies, aren't there? Let's go through them.
Well, for anyone, heart disease is the major killer of both men and women. Lung cancer used to be that the men led. The women have caught up, I believe.
Oh,
and
yes.
Diabetes, of course, affects both sexes.
So, we hear about these different things and we know we're supposed to make changes. It doesn't hurt to just hear it again. What do we need to do, men and women, but let's focus especially on men. What do men need to do to change these statistics?
I think that a lot of men, like women, have it all wrong. They think that to change their statistics, they should go to a doctor and have the doctor do something for them.
Right.
In fact, the most important changes are what we do for ourselves, because all of the big killers, the chronic illnesses that either kill us prematurely or that make us unable to pursue the kind of life we have later in life, these are behaviorally related. It has to do with our activity level, it has to do with our nutrition, it has to do with whether we smoke, whether we overuse alcohol, and surprisingly, even how much we like our job.
How much we like our job, that's a factor as well?
I'm thinking of the Whitehall study, famous in occupational medicine circles, that showed, studying British civil servants, that perceived work stress is very bad for your health. And those who perceived that their work was stressful found that it was for two reasons. Number one is if you have little autonomy in what you do, how you decide to spend your workday, and if you're under a great deal of time pressure. So you can think of somebody working on an assembly line where that part is coming down and you have to jump at it and you can't even break to go to the bathroom, versus a tenured college professor who has limited time pressure and a great deal of autonomy in how to spend the workday.
I guess if you hear all that, it's not like it's super shocking stuff. It all makes sense. But still, the stats are what they are and they're not going in the right direction. And, maybe we just have to keep saying it every year to really get people to make some changes. If you had to say, as we leave here, one thing people can do or one thing men can do to prolong their lives, what would you say it would be?
I recently heard a talk by Brad Biskup, who runs the Lifestyle Modification Center at the University of Connecticut Health Center. He stated there are roughly 40 conditions where physical exercise has been shown to either reduce your risk of getting it, or if you have it, to improve it. These range from colon cancer, breast cancer, cardiovascular disease, diabetes, and dementia.
So we got to get moving. Wow.
We have to.
Keep on moving, and that goes for women as well. All right, Doctor, thanks for coming in. Really, really important stuff as we celebrate the men in our lives this week. Thank you.
Happy to be here.